How did Vietnam, where medical advances impact civilian care? Imagine a time when saving lives were meant not just bravery but also groundbreaking medical progress. During the Vietnam War, new techniques and tools changed how both soldiers and civilians received care. One of the most important changes was the use of helicopters to evacuate the injured quickly. The Bell helicopter, often called the Huey, could get wounded soldiers to hospitals in about 35 minutes. Before that, it could take hours to reach help. This quick response saved many lives and later helped civilian emergency services develop helicopter ambulances for accidents on highways and in cities. Hospitals built helipads on rooftops to make this even faster. The war also saw the rise of flying intensive care units. These were aircraft equipped with advanced medical equipment and staffed by specialized teams. They could provide high-level care right after injury, even before reaching a hospital. This idea influenced civilian air ambulance services, making it possible to treat critically ill patients during transport. Wound care improved a lot during this time too. For burns and serious injuries, topical antimicrobial treatments like Sulfamylon Burn Cream were used widely. They helped reduce infections and save lives. These treatments later became standard in civilian burn centers and trauma units. Blood transfusion techniques also advanced. Using Type O universal donor blood and better storage methods meant wounded soldiers could get safe, quick transfusions. These practices were adopted in civilian blood banks, helping patients with severe blood loss recover faster. The war pushed forward mechanical ventilation, physiologic monitoring, and fluid resuscitation. These innovations improved how hospitals cared for patients with penetrating injuries or internal damage. Many medical personnel who served in Vietnam brought back their knowledge and skills. They published research and introduced new surgical and emergency techniques that shaped modern trauma care. Looking at the bigger picture, these medical advances occurred during a time of intense conflict and societal upheaval. While they saved many lives, they also highlighted the human toll of war. Civilians in Vietnam, suffering from diseases like malaria and dysentery, received treatment alongside wounded soldiers. This blurred the lines between combatants and non-combatants, showing how humanitarian crises unfold during war. Today, the legacy of these medical innovations is clear. They helped create faster emergency response systems, better trauma care, and improved burn treatment. These improvements have increased survival chances for civilians facing emergencies and continue to influence medical practices worldwide. The Vietnam War proved that military medical progress can benefit everyone, especially in times of crisis.